Craig, okay, you ready?
So are we ready to, Craig, I think we need to put on recording again, please.
There you go.
So the next thing that we have up are,
Leslie, for the minutes, we moved to exit executive session at 10:47 was my motion. It was Deborah's second, and it was a 4-0 vote.
thank you, Jeff,
Okay.
for making that public. I appreciate that very much. So we're moving now to begin to handle our requests for budget adjustments. The first one we have on our list is GEMS for release of conditions of $2,350,000. GM2 is Tracy on? We need to bring Tracy up. Tracy Seetinger is it, and I guess Tom Miserandino is with her also. Is that correct?
Yes.
Hi, guys.
Hey,
Can you guys hear us?
Is there anyone else, Tracy, that you need to have brought up? Or the other two of you, the ones that only ones?
Just Tom and I, and we're together.
Okay, great. I just wanted to check and make sure we have other attendees, and I wanted to make sure none of them were. So thank you for being with us. And
You're moving up now.
Oh, Andy, by the way, Andy is in the participant.
Andy Dews?
Yeah, he's an attendee, and so is Laura Erickson. I don't know if you bring the rest of them over, you keep them there.
No, I think we've kept them.
Okay.
The budget committee is the way we've handled it in the past, Deborah.
Okay.
So, but Tracy and Tom, would you like to give us an update and thank you for being here. Tom, I mean, if you could move a little bit closer to Tracy. Yeah, exactly. You're not in the picture.
We're trying to social distance here.
We don't want to lose. Well, that's true too. You can move backwards then. You don't have to. It doesn't say how it has to be.
We're fine.
But just to make sure, the way you were, we couldn't see you. So, or just one talking at a time also works. So Tracy, how would you like to start?
I'll start with an operational update of our last quarter, which, as we all know, has sort of been overshadowed through the COVID-19 pandemic, as this covers February, March, and April. So basically, at the February, beginning of March, we started encountering our COVID-19 positive patients on March 10th. We experienced our first interaction where we weren't exactly prepared, and the crew had to be self-isolated for 14 days because they did come in contact with a unknown COVID positive patient at the time and did not have proper PPE on. Since then, obviously, we have been wearing our PPE. As you all have probably heard in the news, there have been struggles with PPE is personal protective equipment for those of you who aren't aware. So that's our masks, our gowns, our face shields, our gloves that we wear every day. These are gloves we wear every day. We don't always wear a mask prior to COVID. We don't always wear gowns. But now on every single call we do, because we have to treat every patient as if they could be COVID positive, and we need to stay healthy so we can be out there servicing the citizens of Greenwich. So during these PPE issues, there's something called an N95 face mask. That was one of our biggest struggles early on. The N95 is a type of face mask that kind of filters out high particulates, and it'll filter out the COVID-19 virus. Those, as we all know and have heard, are in high demand. We have run out. We are following the CDC's guidance, and we're on a contingency plan. So we're replacing them every 7 days. So they're doing limited reuse. So in one way we came up to sort of overcome this PPE shortage, we got full face respirators. So they basically look like gas masks. So they have your entire eyes covered, and then there is a P100 filter on it, which is actually a step up from the N95. So we were able to secure those early on in March. And we have had everybody fit tested thanks to the help of the police department. So we're pretty lucky in that regard. So, you know, those are some of our struggles. To date, we've had 5 employees, you know, out of about 60 is good. 5 employees have tested positive. Now, remember, a lot of people in EMS also work other jobs part-time. So there's no way to know that they got them from transporting a patient in Greenwich or the gas station or the grocery store or at another agency. But everybody to date is back to work and healthy. So we're excited about that. Some of the things that people have been doing to try and help us remain healthy, Stanford, ServPro of Stanford has been cleaning our ambulances with a special, they come in with this big machine and they basically spray down all the ambulances, goes through the venting systems and everything for free. So they're just looking to try and do what they can to help, you know, flatten the curve, which we clearly have done, and that's been great. One of the other concerns that we've had as a result of COVID, and it's not a concern, it's a good thing, call volume is down, which means we're not bringing a lot of patients to the hospital. The problem, the downside of that is we rely on patient transport revenue as part of our budgeting. So we're about 25% down since March, end of March. And that seems to be tracking through the end of May, still first week of June I did it, still 25% under budget on patient transports. So I'll let Tom talk about some of the revenue effects and we'll speak to that, but I'll just cover some more operational things. One of the other major concerns we were having was trying to deal with the mental health of all of our staff. So I'd say beginning mid-March through mid-April was sort of our height of when we were really dealing with more than 59% of our calls were potential COVID patients. Again, I know that I said we treated every single person as if they were COVID positive, but in the end, nearly 60% of them were actually screened, and of that, 20% tested positive. So it's kind of difficult, you know, we're dealing with something that we've never dealt with in EMS before. We deal with pandemics, not a pandemic. We deal with infectious diseases, you know, Ebola, SARS even, and we've never really had an issue like we had with COVID-19, where we haven't had the supplies that we need to properly treat these patients. So it was a little stressful. You're also shutting down essentially the United States. Your kids are now home. You have to homeschool. You need to worry about transmitting it to potentially your parents who may be elderly. You need to manage your kids. You need to manage yourself. It is extremely stressful on them. We did everything that we could and continue to try and manage their mental well-being. We did bring in some people from family services to reach out. The hospital put together some peer work groups, and I know that some of our employees did actually reach out to that. So again, we're still trying to focus on that because it's not over. It could pop up, you know, again this fall, and we're just trying to manage that. Otherwise, everybody, like I said, is working.
Tracy,
Yeah.
we keep losing you. Could you just make sure you speak into the speaker, please?
Are you losing me because of connection, do you think?
No.
Or
I think
Okay.
sometimes you move a bit away from the screen.
okay. Let's see. So throughout all of this, we obviously, since we have a 25% decrease in call volume and the decrease in revenue, we have done what we can to try and offset some of this. We have applied and received the PPP, which I'll let Tom speak to. We did get, because we're a participant in Medicare, we did receive a $59,000 grant through the CARES Act, the Provider Relief Fund. We did receive a United Way grant to purchase our protective equipment. We did purchase some, but it's all on back order, so we haven't received it yet. And we did apply to a couple of foundations and did receive a grant. So that's all good news. As far as how we ended our fiscal year, we end in April. We ended with 6,200 responses for our fiscal year. And we transported 3,961. That's 240 calls under budget. And if you look at it, it pretty much ties to COVID, March and April. So we've been pretty even the past 3 years that I've been here as far as our transport volume and our response volume. So hopefully that will pick back up. Our cardiac arrests for the year were 36 total cardiac arrest transports. And of that, we had a 30% return of spontaneous circulation. So save rate was 30% for FY20. Again, it hasn't changed. I checked today just to make sure. The national average is still 10.8. So this year, it fluctuates day to day, but that's where we landed this year was 30%, 36 transports out of the 3,900. Our response times ended, our averages for the year, 73% at 5 minutes or less and 93% at 8 minutes or less. So we are consistent with our previous years and that complies with the contract. We started this last quarter with February, which included one of our fundraisers. We do every year we do some sort of a dinner. We called it Gemstoberfest. It was an Oktoberfest theme event. It was a lot of fun. The last hurrah right before COVID. We were able to raise $125,000 toward our capital fund. So that was amazing. We thank everybody who was there to support us and will help us purchase AEDs, ambulances, the heart monitors, all of these things that we utilize to perform life-saving techniques. COVID, though, we normally would have had a COSCOBR fundraiser, which is the COSCOBR helps give the proceeds to GEMS on one certain day. Our kids' triathlon that was successful last year, we had to cancel. There was something else we had to cancel. COSCOBR slips my mind. The good news is our fiscal year to date was about $650,000 of fundraising for capital needs. So that's how we ended April 30th. So we were able to purchase 2 new ambulances last year. Remember, one because of a fire, and this one is our normal purchase. So, as well as the 2 new public access AEDs down at Todd's Point that I believe we've spoken about in the past, that we worked with the Friends of Greenwich Point to help purchase those. And we are in the process of adding 3 outdoor public access AEDs at Greenwich High School. So I'd like to end on a good note, so we'll end on that note, unless anybody has any questions about operations.
So why doesn't Tom sort of do the numbers part? That would be helpful.
Sure. All right, so as we all know, our fiscal year ended on April 30th of this year. It was a very good year for GEMS. We had a net change in operating assets of $445,000 and a net change in total assets of $647,000. On the revenue side, we ended the year 1% ahead of budget, and that was $46,000. This was primarily achieved by, Tracy just mentioned, the stimulus we received from the Health and Human Services of about $60,000, which put us over. Otherwise, we would have been exactly on budget if it weren't for that grant we received. Other points to note: training revenue was 44% ahead of budget, which is $49,000. Patient revenue was slightly below, and that was all driven in the last month. That was 3% below, which is $76,000. And then on a positive note, our investment income was at $24,000 for the year, and this is compared to $3,000 on the year prior. And this was driven by the change in investment policy that was started a little over a year ago here. So all positive notes. On the expense side, we ended the year 5% below budget, which is $398,000. Three main drivers for this. Big one being on the comp and Benny side. That was 5% below budget, which was 311 of that 398. And the other two were rent and vehicle repairs. Rent, I think we had mentioned to you that we had negotiated a new lease which began in October, which offered significant savings. And then we were just under budget 28% on vehicle repairs, which was about $36,000. Cash collections, as a result of COVID, you could imagine we're down. My most recent month I have is April. On average, we collect about $180,000 from patient receivables and cash. Unfortunately, given COVID-19, that was driven down. We collected $155,000. And as Tracy mentioned, billable calls were also down a little over 25%. We did about 257 billable calls in the month of April. That's it for the year. If we, that was kind of the good news part. What I'd like to talk about now is kind of looking forward and the impact of COVID-19 on fiscal year 2021. So I did some work around that where, if we carry through this 25% reduction in billable calls, and I said, let's just look out through August. Again, no one knows when this will end, and what kind of impact that would have on our business and our revenue. And it would have about a $330,000 impact on the revenue side. Unfortunately, again, as Tracy mentioned, we have some help with some grants. We did get the PPP loan, the United Way grant as well, and that $60,000 from the Health and Human Services. That helps offset some of that. Along with that reduction in revenue, also is there's an offsetting reduction in some expenses, certainly on the training and standby lines, which is about $92,000, which gets a net impact of about $237,000. Again, assuming that this just carries on as it is today through the end of August. And I think and that's all I had. If you have any questions, I'd be happy to answer.
So can you just please differentiate for me and the others what grants and, COVID funds that you've gotten in for this quarter versus what you got in for your fiscal year end, please?
So PPP came in this quarter. That came in the month of May. Intercity Fund also came. That was a grant from a foundation we received at the beginning of May. The Health and Human Services stimulus came in the month of April, so that was in prior year. And then United Way, I'm not sure, did that come? That was April as well? Yeah, okay. And that one was in April.
Thank you. And is there other COVID funding that you will be able to apply for, given the situation continues?
There is one other. It's the Emergency Disaster, EDIL it is. I forget what the acronym is for, which was originally a $10,000 grant, which we did apply for. Given the large response to that, I spoke with the SBA on that, and they had changed the program now to become just a true loan application. which they are targeting roughly $1,000 per full-time employee that we could apply for. At this point, we are not applying for that. Just more, I'm of the mindset of not wanting to take on debt and the and the uncertainty we have now with the grants we received to date. I think we're okay for the time being. Again, the hard thing is not knowing when to call the end to this.
Thank you. I think Tracy's, I don't think we're hearing you. We think we're seeing you talk.
You can't hear me?
Now we
Now
can.
now we can. We couldn't before.
So one thing that we also are working on is with federal HSS and Medicare is we've applied so that we are able to bill the uninsured COVID patient. So typically these would be write-offs to us. And this is part of the CARES Act, but it's a totally different application. And that's what we're working on as we speak. I don't anticipate us not being able to move forward with it. And I think we have about 9 uninsured COVID-related patients that we have pushed to the side right now. So these are any type of option that we have, we're trying to follow that up.
Thank you. I know it's hard to operate your own business and then try and address all these additional programs and balance out your revenues with the expenses in a very difficult pandemic environment.
Well,
Are there other
if I could
questions?
just
from
add, the other thing that makes it a little difficult is the rules keep changing on these things. Certainly, I read on the PPP loan program, rules and requirements around that changed. And this was in the middle of May, 14 different times there have been amendments. And I know most recently last week, I know the president signed into effect one more amendment, which is very helpful, where they extend the time that you could apply that money to payroll and qualified expenses from 8 weeks to 24 weeks, and lowered the amount. It used to be 75% needed to be spent on payroll, and they lowered that hurdle to 60%.
So you're staying on top of all that. So thank you very much.
You're welcome.
I think Jeff has his hand up.
Yes. Off the face of your books, by the way, as usual, I compliment you on your operation. You seem to run the operation very well. I compliment you on the finances. I think you've come through a difficult time very well. Just on the lessons learned, is there a value you think going in forward in trying to maintain an inventory of N95 masks? I know you use rubber gloves routinely, but on PPEs and masks, is there a value you think that's worthwhile for you to actually have an inventory against the next SARS, MERS, COVID, avian flu, swine flu, Spanish flu, et cetera?
Yes, exactly. I think that there is, and we placed 2 separate orders from 2 separate vendors for N95s and gowns. Again, not something that we typically use, and we will store.
Lean over to your monitor again.
Here, what if I turn it a little bit?
Perfect.
If we will be basically keeping stuff on hand always. I honestly think that, when I first started in EMS, you didn't always wear gloves on every single call. That has transitioned. We do on every single call now without question. And I do think that this pandemic actually will change the way we function. I think we'll wear masks on every call. And to your point, the N95s, we will probably have at least 2,000 as well as gowns in storage. When they expire, if we will just have to, keep rotating them through to make certain that we have them. Definitely a lesson learned. We ordered them right away. Who knew that they were not going to be able to make them fast enough? And we did struggle going down a lot of rabbit holes looking for, KN95s. There's a whole host of different manufacturers out there, but they were all fake. It was extremely troublesome. So we're going to do our very best to prevent that in the future.
Are there any repositories of them at governmental entities, either the town or the state or the federal authorities that you're aware of?
There was a state repository and they were all expired. So they did give them to us because the CDC did say that they have some value, that you can wear them even though they're expired. And on a normal day, you wouldn't be able to. They did not have anything as far as a repository of any in stock. They were actually from the first SARS is what they were holding them from.
Okay.
We also had the same ones. The problem is they were so old, they were disintegrating in your hands.
Okay.
So that's why we spent the money on the full face masks.
Right.
The good thing about this is they are assigned to an individual and we just change out the big filters that are on the sides.
Right.
So,
Thank you
Thank
very much.
you.
Mhm.
Leslie, do you have any questions?
I do. I wanted to ask, Justin, and how you address this revenue shortfall and looking at your expenses. What, if any, of your expenses are variable for the lower call volume that you're experiencing?
Well, to address the revenue shortfall, that's kind of really the main purpose of the PPP loan we received. So again, hopefully, the PPP loan is slightly larger than kind of what I projected our shortfall to be through August. So I'm comfortable, I guess, with that part of it. On the expense side, on the variable expenses as a result of this, what can we, certain things, again, training and standby certainly will go down, only because they're either being delayed or canceled. Many town events have been canceled, so that's a source of our standby revenue. Training, we have canceled some of it. We're trying to schedule some in a different matter, a large portion of it being done remotely for later in the year. We'll see if, how that works out. Tracy, did you have?
Tracy, we can't hear you once again.
oh my God. I can't turn on the speaker that goes all the way around for some reason. I would anticipate fuel to be slightly less. Number one, the cost went down and we're utilizing less. And along with that, vehicle maintenance. Now, we do have routine preventative maintenance that, will happen regardless. But as far as, as many miles being put on the trucks, the overall maintenance during this time frame should be down.
Right. We've certainly seen articles in the paper about some of the elective procedures at hospitals starting to increase, that things are starting to turn a little bit. Have you seen anything about the impact on your recent call volumes that's different than it was maybe in April?
I don't wish, that doesn't sound right. I don't wish people to be ill or require our services, but we have not seen. I look every day. So for example, we did, and a lot of people are afraid. So during all of this, there are people who absolutely needed to go to the hospital having a heart attack. We couldn't make them go. And because, it's a very scary situation. The problem is they were more afraid of COVID than they were the blockage in their heart. And that was really troublesome for some of our crews as well. We did 3 transports on Saturday. Saturdays are usually busy. It was a beautiful day. Should have probably done 20 typically. Sunday we did 6 transports and Friday we did 7.
Wow.
Again, our averages are 20, so I haven't seen it yet.
Yeah,
A lot of people have left town, I think, from what I've heard.
That's true. I know that probably will change. I wanted to ask one more question, if I could, and this had to do about the fiscal 21 budget. You provide us with some information, but your budget also was reduced by $48,152 from what you requested and what was approved by the budget committee to the final budget. You sent us how you're accommodating that change, but can you just, is there an impact on service levels as you see it from the change that was put into the budget? No. So you're able to accommodate that just by tightening the belt a little harder, for lack of a better cliche.
It'll be
Exactly.
tight.
That, and, you know, so, you know, some of the things, so Tracy just mentioned fuel. We brought the fuel budget down a little bit. Another one, we, again, renegotiated a contract with our payroll provider, which saved us roughly $5,000 or $6,000. So there are some proactive things we could do, as well as things as a result of this that will actually cost lower. So again, I'm comfortable.
Okay. Thank you.
Thank you for that update. Deborah, you have a question?
Yeah, a couple of things. Well, first, I want to say thank you. I know being a first responder during these last few months, I can't even imagine what you and the team are doing to keep our community safe. So I just want to thank you for all that you do. GEMS is a very valuable service, and I personally appreciate all that you do. I just, you talk about the revenue shortfall. You kind of talked around it, but I don't feel like I completely understood the answer. If your revenues are down, you call volume 25%. How do you? So there was one thing dealing with the fact that your budget was kept flat from the town's perspective, but how do you deal with the 25% down? Related to just not having the calls, and I know the PPP will help and other things will help, but how do you bridge that gap?
Hopefully the PPP.
Yeah, no, it's exactly that. So the PPP will cover that, and like I said,
Okay.
it will more than cover the shortfall that I had mentioned as of now.
Okay.
My concern is if this thing goes on for, say, another 6 months after August, or into calendar year 2021. Then it gets concerning, and obviously we'll have to we'll address it then.
Great, thank you for that.
You're welcome.
So we all thank you very much for everything you've been doing and in putting yourself in a difficult situation in this pandemic. Do I have a motion to recommend that we release the condition on GEMS?
I'll make the motion.
And do we have a second? Deborah
second.
seconds it?
Sorry.
And so it's a condition. So the vote is, you want to individually vote? Leslie?
I vote yes.
Deborah?
Yes.
Jeff?
Yes.
And I'm a yes. So that's 4-0-0. And we thank Tracy and Tom for joining us today. Thank you very much.
Thank you.
So we will move on now to Nathaniel Weatherall. I see Larry Simon is attending. Can we have Larry brought up to our panelist, and also ask Larry if he's brought anyone with him that he would also like brought up to be a panelist?
Can you see me?
We can
hear you.
We can hear you, but I don't see your picture yet.
He's coming.
He's muted right now.
He can.
Larry, we can see you and hear you. Is there
Okay.
anyone else you want to bring up?
Not yet. No, now I think I've lost you.
No, I'm here. Slide your screen one way or another.
Hold on.
The sun must be going in and out, Larry.
All right, I can see everybody.
Okay, great. So thank you.
Everybody.
So thank you for joining us. And why don't you describe a little bit about what you're requesting? We have why don't you discuss the adjustments requested, and then perhaps you can give us some additional background. You sent a great memo to your board members, I think last Thursday, that Andy shared with us, and perhaps you could share some of that as an update also. That would be helpful.
Well, first we're asking for a transfer from the salary lines, the 100s to the 400s, in the amount of $70,000 to cover additional general maintenance expense, and to the 700s to cover the redemption of bonds which were omitted from the budget in error last year. So maybe I'll answer questions on that first.
And you have excess money available in your salaries line that you're transferring from.
I have sufficient money available in the salary line to make the transfer. I would never use the word excess.
Okay. but the spirit is about the same in today's environment. So, do we have any questions on the requested application from any of the other budget committee members?
Yeah, the question I have, if the general maintenance budget that you're requesting to cover this year probably is not sufficiently different in fiscal 21, do you expect a problem in your 21 budget for maintenance?
I think there were some hopefully one-time items that occurred in our budget this year, such as the air conditioning breaking down in the IT room. We had valve replacements that we had. I think a lot of these are one-time items. I mean, and I also think that the prior administration didn't use the money as judiciously as I would have used it.
Okay, and what about the redemption of bonds? Was that budgeted in fiscal 21?
Yes.
That is, okay.
So I don't think I have any questions. You want to just take a minute, Larry, on, oh, no, wait a second. I see Jeff has his hand up. Sorry, Jeff.
Just, I didn't know what enhanced patient security systems are.
So that prevents people from eloping. So if you have on an electronic bracelet, you're not supposed to be able to go through the door. The door is supposed to shut and you cannot escape is the wrong word. You cannot elope from the nursing home, but the doors weren't working properly and somebody could force their way through them. So we have enhanced the security and we put them on additional doors so that we will not have an elopement issue anymore. We got fined, as you remember, maybe remember, by the state for this happening. That wasn't pleasant.
So, Larry, any other questions? Take 1 minute to sort of summarize the key things that you addressed to your board in the great memo that you sent last Thursday that was shared with us
So
for the public.
I'll tell you, it was also interesting listening to the discussion on GEMS. Getting masks, for us, getting the masks are not the problem, but the state is giving us masks and masks are readily available. Gowns are in very short supply. And I'll just give you an update on, we've applied through the town for a FEMA grant for extra money. And we put in expenses of $730,000, I think. And I'm counting on Peter to deliver that money by the end of this month. So we'll see. Not really. And then, we've gotten COVID money from Medicare and from the state. So that's all been very helpful. We've opened ourselves up and we've taken in 2 or 3 new admissions and we're open and we've constantly called the hospitals saying that we want to take on additional admissions. But as you referenced earlier in the discussion with GEMS, hospitals are only beginning now to do elective surgery and they're only beginning now to start discharging patients. But there is a backlog in the community of people that did not want to leave their homes and they didn't want to go to the hospital and they weren't so comfortable going to nursing homes either. But that's starting to change and people are starting to be admitted, not in the volume I would like to see, but more. We have 134 patients now. I mean, we'd like to get ourselves back up to the 180 level, but that's going to take some time. And the other part is that we have 7 people that are infected with COVID. They're on their own ward, but we're required by the state to start testing all of our staff this month to make sure we don't have positive people. I've got numerous questions as why we don't test everybody all on the same day. But if everybody came back, if I had 30 people positive on the same day, we wouldn't be able to run the facility. And then people ask me, well, why do you have positive people working there? But they don't have temperatures, they don't show symptoms, but they still may be positive. So that is why we're doing staggered staff testing. And I can answer any other questions you might want. I'll do 2 other things. So we're making an offer to the director of nursing this morning, finally getting a director of nursing after an absence of essentially 6 months. And we made an offer, we're going to make another offer to a director of finance today to start at the end of this month. And essentially that position has been vacant for almost 7 months. So it's been a struggle. And we've done the best. And then to answer Leslie's question, which is coming up, Leslie Moriarty's question about the fiscal year 21 budget. It depends on two things. One is what happens in the labor contracts. If in fact the unions will take a zero or not, that would help us. Won't help the labor unions, but it would help us. And two, the healthcare increase was moderated. So that also helps us somewhat because in our budget, we pay for the healthcare increase, and that represents $300,000 above and beyond where we are this year. But we're really focused this year on reducing overtime, for next year. And we're focused on reorganizing the nursing department and flattening the curve, making it less hierarchical, more patient care driven, fewer RNs, more LPNs, more CNAs. We've printed a list of all of our vendors, and we're looking at each vendor that we have. Do we need them? Is this a service we should be paying for? Are we paying the right amount of money? So it's really, as a positive, prompted a very tight scrutiny of all of our expenses and ways in which we can control it. We're developing management tools by which we think we can better manage Witherall. And of course, the wild card will be if we get a lot more patients and our revenue goes up, then our costs may go up. But then we'll deal with that as a more positive situation.
So we thank you for dealing with two stressful environments, both, working to manage the costs at Witherall as well as managing them in a very difficult pandemic environment when obviously Witherall is one of the places in town that was hit the hardest. And it must be extremely stressful for you and for everyone else to, know that so many of the residents and staff members too have contracted this, terrible disease. So, we thank you for that. Do I hear a motion?
I just want to say one more thing, if I could. So the hardest part has been on the families of the residents because we don't allow visitors, and we're working very hard to improve the bandwidth within Witherall to allow more Zoom and FaceTime. And we're trying to figure out how to have family members meet each other out on the porch outside because people, it's an important part of the care and the relationship with the patients to see your family. And that's been the most stressful part for everyone, not me personally, but for everybody else.
Thank you, Larry. Do I have a motion to approve this application for Witherall for $130,000?
I'll move.
Jennifer?
Yeah, I'd second Deborah's motion.
So Deborah, seconded by Jeff.
Mhm.
And
Mrs.
those in
Francis.
favor?
Aye.
Yes.
Aye.
Okay, so that's a Jeff, Deborah, Leslie, and I have all voted yes. That's a 4-0-0. Thank you, Larry.
And do you think this will be routine?
Yes.
I
for me.
think this will be routine. Routine, Jeff? Yes?
Yeah, yes, for
Deborah?
me.
Deborah? Leslie?
I'm sorry, I
Yes.
keep it on mute. It's just easier. Hi,
Leslie?
Larry.
Yes, routine.
Okay, yes, yes, Larry, routine.
Thank you.
Thank you
Bye.
very much. Okay, so next we have TAG. And do we have Mark Miller? Can he be brought up as a panelist? And does Mark have anyone?
Jim Mill, is it?
I'm sorry?
Wait, sorry.
And does Mark have anyone else that he wants to bring up as a panelist also?
Hello, this is Mike Miller.
Oh, excuse me, Mike. I'm sorry. I apologize.
Not a problem. I've been called worse.
No. Sorry. Anyone
Um,
else you want to bring up with you?
Deb is on the phone. The last
Mike, are
four
you there?
digits of her phone are 3638. So if the host can allow her or invite her in as well, that would be helpful.
It's Deborah Vetramile.
The phone number has been unmuted.
Sorry about that, Mike. So would you like to give us an update on your release of conditions, your request for release?
Mike is muted right now.
In
Mike, you're muted.
terms of where.
Mike, you're muted.
There.
Mike, can you unmute yourself? There,
I believe I've unmuted myself now. Can everyone
Yeah.
hear me?
yes.
Yes.
Okay. Hello.
Hello.
Welcome to this new world. I'm going to read something that has typically been included in several of our applications for grants, and it basically summarizes.
Hello, we can't hear you.
Can you hear me now?
Yes.
I must have been too far away from the microphone. I'll try.
Yes, we can hear you now. We couldn't hear you there for,
Okay, so I'll try and stay as close to the microphone as possible.
Thank you.
So I'll repeat, included in the application for several of the grants that we've recently put in was an initial commentary to talk about what has taken place at TAG. And so I will read that just to get us started, and then we can branch off from that. Greenwich began experiencing the effects of COVID-19 pandemic in March. Initially, Greenwich residents, business owners, and town leaders were all unsure of the potential duration and severity of the evolving COVID-19 crisis, and along with many other communities, elected to continue normal day-to-day operations while attempting to maintain appropriate limited gatherings and disinfect surfaces where possible. TAG maintained full operations as well while following the safety protocols mentioned above. In mid-March, as the severity of the pandemic became more apparent, many Connecticut residents and businesses began to voluntarily self-isolate. And during this time, TAG began to receive many reservation cancellations. TAG's local agency partners began implementing preparations in anticipation of an eventual shutdown. By late March, First Selectman Camillo and Governor Lamont had issued stay-at-home directives for the town and state. In mid-March, TAG's management and board of directors began reviewing potential changes to operations in order to respond to likely community needs during a severe and long-lasting COVID-19 crisis. TAG's executive director, concerned about Greenwich neighbors losing their jobs, reached out to her counterpart at Neighbor to Neighbor and posed a question. Was there anything both organizations could do together to help struggling local residents? A partnership was formed and planning began for what would eventually become the Feed Greenwich program. Over the next several weeks, Neighbor to Neighbor, TAG, and the Greenwich Boys and Girls Club began working together on issues of client intake, food procurement, packaging, scheduling, delivery, and securing a central location operations hub. The program partners worked closely with town leaders from the First Selectman's Office, Greenwich Department of Human Services, Greenwich Board of Education, Greenwich Commission on Aging, among others. And as a result, appropriate resources were brought to bear for a community food procurement and delivery program rollout in late March. The Greenwich Time reported on food procurement and delivery program partnership and distributed this message broadly to the community with news articles showcasing Neighbor to Neighbor and TAG. News 12 also ran a video of Neighbor to Neighbor and TAG at the Feed Greenwich Operations Hub, newly installed at the Art Street Teen Center. TAG management reviewed with TAG board the prospect of redirecting all of TAG's resources to food delivery programs, serving struggling and vulnerable Greenwich residents for the duration of the COVID-19 crisis stay-at-home period. The stay-at-home period was initially expected by town leaders to last roughly 7 weeks through May 20th. The board voiced unanimous support for the proposal. TAG's management and staff are proud to be able to serve 2,000 of our Greenwich community neighbors during this difficult time. The Feed Greenwich program has received a tremendous positive response from all corners of the Greenwich community, and a common thread has been repeated to TAG management and staff countless times. So many communities would love to be able to meet their residents' food insecurity needs during a crisis with programs similar to Feed Greenwich. However, they are unable to do so because they don't have a tag. Food delivery providers such as TAG were ultimately deemed to be essential service providers during the crisis, and TAG drivers and office personnel continue to work while placing themselves at significant risk of COVID-19 infection. 2 drivers actually went into isolation after contracting the virus, and to date, they've both returned to work after isolating for 14 days and testing negative. Recently, Governor Lamont canceled the remainder of the school year, which serves to acknowledge the severity of the updated COVID-19 projections in the state surrounding the crisis. Many are suggesting that the effects of unemployment and food insecurity could last for many months beyond the relaxation of social distancing directives. Once the likelihood of easing stay-at-home restrictions is firmly on the near-term horizon, TAG will begin planning for a transition back to pre-crisis operations. And with that, I can now move into any questions anyone may have on the financials, or I can provide a summary of the updated 2020 forecast and the updated forecast for 21 versus the original plan that was approved.
So I had one question about Safe Rides. You've asked for a contribution to Safe Rides, but when I read your package, it looks like Safe Rides has been, your words are Safe Rides discontinued. And so I was just wondering if you could just update us on that, please.
So I didn't prepare the summary sheet, and I assume the summary sheet was prepared with the expectation that the traditional summary sheet should continue. We're not expecting any funding from Safe Rides, although I would make the following statement. One of the items that we've noticed that is most at risk in our forecast, both for the remainder of this fiscal year, which ends on June 30th, as well as our next fiscal year through the remainder of the crisis, which we are planning to run through the end of September. Could go beyond, but we're expecting to continue the Feed Greenwich program for as long as is necessary. But just for planning purposes, within the plan, we're assuming to the end of September. We understand that the Department of Human Services is working diligently on trying to find funds in order to support the fees that they are now paying to TAG on behalf of the Feed Greenwich program. To the extent that the funds that were initially requested for Safe Rides, which we've agreed will no longer move to TAG since we've closed down the Safe Rides program. But should they be available in some other way, we would request that they be redistributed, if possible, to the Department of Human Services to help them as they locate funds to pay for the Feed Greenwich program. So that's my only statement I would make with Safe Rides. But no, we had not been expecting, nor would we expect that those funds would come to TAG.
So, Mike, if we go back, the community development block grant, I think it said that there was $96,000 in there for this, for TAG, for this program. Is that what you understand? And can you explain how that money is being used?
Yes, and the expectation, and I understand that $486,000.
We've lost you again.
Hello?
I'm sorry, we lost you.
Hello, can you hear me now?
We can't. Thank
Okay, it's very, I need to stay very close so you'll catch part of my face. The program that, the CARES program, of which the additional funding became available to the town for $486,000 as part of the overall CDBG funds that are provided to the town. The initial proposal that came out of the grants committee for TAG was $96,000. That has subsequently been approved by the first selectman. And now, as I understand, it goes before the RTM today, I believe.
Yes.
And should it be approved by the RTM, those funds, which we would expect to be received at some point in July, will go towards the operations for the Feed Greenwich program during the first 3 months of our new fiscal year, from July through September in our fiscal year 2021, but that would be July through September of 2020.
So that would, does that sort of satisfy the need then for these additional funds that you were just talking about?
So as you take a look and with the expectation that we are at current levels of the Feed Greenwich program is roughly 540 families, over 17 to 1,800 and beyond Greenwich residents are being served by this program each week. It fluctuates week to week, but if we continue at this level, our expectation would be that for the first quarter of our new fiscal year, at a minimum, we would require 25% of our overall $279,000 funding for the year. To the extent that the Department of Human Services is not able to locate sufficient funds to transfer fees to TAG during this period of time sufficient to cover our costs, it would be greatly helpful that the town could consider a 50% allocation to TAG of the $279,000, so that it would give the Department of Human Services sufficient time to locate those additional funds, and they would not need to run around and redeploy funds that they may need for other operations during this time period, and they can do it in a more orderly fashion. So that's the only reason why I would request 50% of the $279,000 be distributed as opposed to 25%, with the unknown as to whether there were sufficient funds from the Department of Human Services to meet the expectations during this period, the first 3 months.
Leslie, may I ask a question, please?
Of course.
Yeah, can I ask one of Roland? Roland, what is conditioned? I thought we had 50% condition release.
We do.
Okay, thank you.
That is the number that's being requested. But I'm telling you that to the extent that, and this is a very strange situation to be in for TAG, as you know, for the past several years, we have been coming to the PET while we've been working through a restructuring, and our typical discussion has been, may we have some more, please, from a time standpoint, because we've been so cash constrained as we've been going through this restructuring. But we are now at a point where, up to the point that COVID-19 hit, we had been running a slight positive cash flow, and we had continued to expect to run a slight positive cash flow. But with the effect on TAG of the COVID-19 crisis and redirecting 100% of our operations to the Feed Greenwich program, we believe we might actually be in a position where we could need less than 50% on day one, but with the proviso that we don't know at this point in time whether the Department of Human Services will be able to meet the total amount of fees that we have incorporated for the Feed Greenwich program during the first 3 months of the year. So that would be very helpful to have that 50% met, just in case, or to give the Department of Human Services sufficient time to identify where they can redeploy funds for Feed Greenwich.
Thank you for clarifying. Deborah?
So thank you for being so like precise and forthcoming in terms of your request and trying to work with us. And I appreciate you always coming, to us with all this information. And thank you for what you're doing for the Feed Greenwich. The only point I have about to question on the 50% is fine. But the human services, is it a timing difference or is it going to be a permanent difference? That's what I'm trying to understand. Do you believe Health and Human Services will ultimately give you that money, or do you think that you won't ultimately get it from them? I just wasn't clear on that point.
So thank you for the question. We do believe that it will be found. We've been talking about potential ways to redeploy additional funds, and from the aspect of timeliness, Dr. Barry and myself and Ben Branyan will be on a phone call this afternoon exploring the opportunities that are available. And just so that you're aware fully of how some of the funds have already been redeployed as a result of River House, suspending operations and no longer needing TAG to provide transportation for some of its daily clients. The Department of Human Services would typically provide a $14,400 on a quarterly basis transfer to River House to reimburse TAG for the cost of those transportation services. For the fourth quarter of our current fiscal year, April through June of 2020, the Department of Human Services has redeployed that $14,400 and utilized that for fees to transfer to TAG as part of the total fees for the Feed Greenwich program. It's expected that another $14,400 will be redeployed in July to September, as the expectation is that River House will not be transporting those clients that TAG would typically transport to River House for those next 3 months as well. So there may be other opportunities such as that might be available for DHS to tap into, and that will be part of our discussion this afternoon.
So any more questions, or is someone prepared to
Can
to
I
move?
just ask a couple questions, because I'm a little confused exactly how the money flows, but I guess you are going to work through that in the sense that the town's contribution to you helps underwrite the services that you're providing for the residents. Most of it in the Dial-A-Ride program, I think, but it's also for the other organizations in town. It sounds like initially that when your services for those organizations ceased, it was almost a one-for-one change to start the Feed Greenwich program, in that your organization wasn't hurt from a financial perspective, that you lost revenue that you weren't able to replace. That it sounded like that you were able to replace your cash flow and your revenues, albeit different service, to continue operations. Is that correct, or did your prior COVID operations generate more revenues to you and therefore cover more of your expenses?
I just want to clarify your question. Was your question related primarily to the fees associated with our shuttered operations in the community?
I focused it on revenues, but it's really a general question of your total revenue expense structure. Were you able to have cover your expenses, albeit with a different business, right? You're not providing your traditional services. You were providing the Feed Greenwich business, and you were getting some compensation, some revenue for that.
And I think the way to illustrate this best is to take a look at the full year 2020 cash flow forecast by
Right.
month. That is of the financial schedules in the section for cash flow schedules. It should be the third schedule. And it is full year 2020 cash flow forecast. Yes?
Yep,
Okay.
I'm there.
So what you see is that through March, and we started getting impacted obviously by mid-March, but on a cash flow basis, most of our cash flow is coming from operations from the prior month that was billed and now is being collected. So operations for February, which were billed the beginning of March, are collected throughout the month of March. Some of our collections were a little bit accelerated because we had some organizations starting to shut down, and we had asked for those that could to accelerate their cash flow. But as you see going their payments, but as you see going into April and then May and then June, other than the residual billings for those organizations that had operations running in March, but had subsequently closed down, the Senior Center and River House, we subsequently received payments on those invoices in April. The Y was able to accelerate their payment for us, so we received the full year March payments through mid-March. We received them before the end of March, so there were no payments received in April. But all of our other organizations, there were no additional services from April forward, so there's no additional cash flow. The offset, as you see, that Leslie Moriarty, as you had suggested, is coming from fees, but the fees that we're receiving both from the Department of Human Services and from the Board of Education. We're providing meals for students who normally receive reduced fee or free meals when school is in session. Those are now being prepared by the cafeteria staff at GHS at the high school, and the superintendent has asked TAG, and TAG has been transporting those meals, 700 meals daily, to schools throughout the community, so those students can pick up their meals locally at their local schools, whether it's elementary or middle school. And so between the fees from DHS and the Board of Ed, part of what the previously expected fees are being replaced, but not 100%. Having seen that that was going to be the case, I really spent a lot of time putting together plans to go out and seek whatever funding from foundations, the government, and any other sources that were out there, additional fundraising. And we've been very successful in our efforts with those applications. In the month of April, as part of the 111,000, over 95,000 has been received from the SBA's PPP program. I had already been working with our community banker on putting in an EIDL loan before PPP was even on anybody's radar screen. And as soon as that hit, fortunately, I was able to redirect with our community banker at Greenwich Bank and Trust, such that on the weekend that the program dropped, we were able to get our application finalized It went in early that week, and we were actually funded the first week that the program went live. One of the few small businesses that were truly small and fortunate enough to actually get funded in that first week. So we received over $95,000 for that program. In the month of April, we submitted an application to the Greenwich United Way for a $100,000 grant, and the United Way subsequently approved us, their grant committee, for 85,000 distribution of funds on a quarterly basis. We received our first distribution of $21,250 in the month of May, and that's part of the 23,000 that we've received in the month of May. And we have several other smaller foundation requests that are pending, and we're hopeful that we'll receive positive responses from that. As we move into our next fiscal year, we expect, as I had mentioned before, that the 96,000 from the CDBG funds will be available sometime in July, and we will return to the United Way, give them an update of our programs, and we would hope that we would get the next 21,000 made available to us at some point in July as well. And so we're working towards recouping all of those lost fees, but it is not just with new fees. We don't think the new fees will be sufficient to offset all of the fees under our existing programs. And that's the reason why our fundraising numbers are substantially higher than previously reported. And just to respond to the question of where the town funds, in particular the town funds go to, with respect to the Dial-A-Ride program has traditionally been, once we scaled back the program to about 4,000 rides a year, it's been roughly about 200,000 of expenses to run that program. The funding for that program, as we've distributed to the BET and others who've requested, is typically as follows. We receive a fixed amount from the state that's based on the town's total number of 60-year and older residents, which is roughly 2%. And we receive another portion of the funds from the state based upon the total geography, square miles, of Greenwich relative to the total square miles of the state. That's roughly 1%. And the combination of those two, of roughly 1.5%, is what drives Greenwich's award from the state of the pool of funds, which is $5 million, has been for years. So 5 million times 1.5% is roughly 75,000. The combined number for Greenwich is slightly under 1.5%. So we receive just under 73,000 annually from the state to support that program. The town is requested to meet the state's contribution, and so from the town's 279,000 that we're expecting for the next fiscal year and the 295,000 that we received this year, our expectation is that roughly 73,000 meets the state's contribution, so that makes 146,000. Fees of about 20 some odd thousand bring us up to about 170,000, and then our expectation is fundraising that TAG does meets the remaining 30,000, and that's how we fund the Dial-A-Ride program. But the remainder of the 295,000 this year, of which 18 is for the Dial-A-Ride, and 279 going forward, the remainder of that balance after the 73,000, which goes to Dial-A-Ride, is for the town-run programs, to support the town-run programs where the fees don't necessarily compensate TAG for the 100%. And that is for the Senior Center, River House, YW, Nathaniel Witherall, Board of Education, the Department of Human Services food program, which typically is about 50 plus clients that is served, not 540, I should say families, I'm sorry, not the 540 families of over 1,800 residents that we're serving currently.
So Mike, we really thank you for this detailed update. And I think, I'm certainly prepared to move ahead with the release of 50% of the town's contribution to TAG for fiscal year 21, which is 139,500. Do I have a motion?
I think Deborah has.
No, I was ready to, yeah, same. I'm ready to make I'm second.
No, you're making the motion?
Oh, I'll make the motion. Yeah, sure.
So Deborah's making the motion. Is anyone ready to second it?
I'll
Looks like,
second.
yeah. Oh, yeah, Leslie. Okay.
I'm sorry?
Leslie.
Did Leslie second it?
After taking off my mute, yes.
Okay, so Deborah made the motion. Leslie seconded. Again, this is a recommendation to the full BET to release the conditions on 50% of the, so those in favor?
Aye.
Aye. So we have Jeff, Deborah, and Leslie, and myself all voting, so that's 4-0. Mike, thank you so much for joining us and giving us so much information. And thank you so much for changing your business and getting it all done in a very difficult environment. We appreciate all your information.
Next time.
And TAG truly appreciates the BET's support and town leadership support as well. We could not do this without the support of the town. Thank you all so much.
Well, thank you. So now are we ready to bring up Joe Siciliano and Tom Greco? Are they?
Yeah, this is Deborah, one comment. So just to be, from a manage expectations, I had this scheduled until 1. I can go until 1:30, but I have a hard stop at 1:30. So
I think hopefully we'll finish by 1.
Okay.
Do we have Tom
Joe's here.
Greco
Joe,
and Joe Siciliano? I see their pictures.
Good morning,
here,
Ms. Joe.
Joe, do you have a
Joe
picture?
is muted, and now he's not. Okay.
Tom Greco, can you identify yourself?
That's me. I'm here. Good morning, Ms. Joe.
Hi,
Morning,
Joe.
Joe.
How are you today? Beautiful day, huh?
Beautiful.
People out there enjoying our parks?
Excuse me?
I said it's a beautiful day. Are people out there enjoying our parks?
Yes, they have been, and quite some numbers too.
Great. So I think you're here to ask us to some capital carry forwards. First is PR3 for 50,000 continue enforced park restoration. Do you want to give us a?
Absolutely. So the $50,000 was a request for the shoreline work that was to be done at Roger Sherman Baldwin Park. So between the transition of Peter Tessie and Fred Camillo as first selectman, this was both one of their great initiatives to try to work through this. We ended up putting out an RFP for the technical services of some engineering and architectural services. And matter of fact, at the end of last week, I was delivered 7 RFP packages from purchasing with seven potential proposals, 5 of them which met the $50,000 requirement and 2 that were over $50,000. So barring reading those and scoring them, the scorers are myself, Al Manelli, and Ben Branyan. We all received the same packages last week. The money, could be spent going forward on one of those packaged engineering companies and architectural companies to come up with some very preliminary concepts of use of the waterfront property that right there at Greenwich Harbor and Roger Sherman Baldwin Park. I understand from the budget document that the $1 million that was requested was been kind of moved out, and that's okay, because we're running a little bit behind on this project here and getting the conceptual design drawings and ideas on the table. But I do know that this is a want or wish of the first selectman is to keep moving. And we do have the resource now with the 5 qualified bidders to select and move forward.
Great. Shall we, any questions here? Jeff?
Yeah, I'm just worrying about the logic of moving forward with design work on a project that was cut. I don't know at what point the majority will want to restore it. Should we be doing design work on a project that may not in fact go forward for a number of years? Maybe it would be more logical to be doing design work at a point in which there seems to be some will to have the project go forward.
Joe, may I just ask a question, expand on Jeff's questions? By talking in design here, you mean conceptual design, don't you? Not detailed designs. Is that correct? And I just wanted to add to Jeff's question here.
Well,
That's correct. There's
actually,
50, I'm sorry.
I mean, from what Joe presented, maybe I misunderstood. We're talking about doing some engineering and architectural work. And candidly, engineering circumstances can change over time, and maybe less so with the architectural work. It just seems to me that I recognize this is not detailed drawings we're doing or something, but we're talking about doing engineering work for a concept on a project which was cut from the budget. And so we're at least a year out, maybe a few years out before this project would be reconsidered again. I don't know. So Joe, I'm sorry, I shouldn't interrupt you.
That's okay. I use those terms generally, engineering and architectural, because all of it will have some of that. But these are concept drawings, layouts. It'll look at the you know the closeness to the Long Island Sound. It'll look at the V zone, all of those things that we have to get down on paper. So there will be some engineering work to cite all of that on a diagram. There'll be some conceptual ideas passed around about how to deal with the parks building, the teen center, Roger Sherman Baldwin Park, and access to kind of the across the way where the parking is and along the pier, the frontage of Greenwich Harbor. So when I use that term, it was kind of very lightly, but there's going to be a little bit of survey work that has to be done. There'll be some design conceptual drawings. They'll be meeting with all the user groups. We still have to decide on, how do we deal with Parks and Recreation maintenance facility and where that might go, or how we can condense. So those are the types of things I'm talking about. But I don't see a hard design coming out of this. I do see some concepts that may be for future development.
And so my one question, Joe, this is part of the original Peter Tessie request to understand more about the waterfront, particularly as we begin to dredge and so forth. There wasn't any kind of, other than conceptual, it's really more a view as what can be done. Is that correct?
Yeah, you might call it a vision of some sort. But at the end of the day, from how we kind of let the bid package out to the returns that we receive, it would be very, very preliminary, very conceptual, with some options of doing several things that could take place there. But it's not going to be at any great detail, and there'll be definitely a whole lot more discussion about this throughout the process. And maybe as we move that forward, this would help also get, we talked about this at the Budget Committee meeting back in February, and there was some discussion about that $1 million and what it'd be used for. Hopefully we can get to a point where we can say, come up with a better number and what it really might be used for, versus just throwing out those concepts. So this should lead us to down that path a little bit.
Thank you for the additional detail. Any other questions, Deborah?
Yes, can I ask a question? Sorry, I didn't know if Deborah had.
Yeah, I had my hand, sorry, I didn't do the physical. I actually am gonna support this. I think that it's important if you can do something conceptual, just kind of tying it into kind of, we're all sort of, boxed up with this whole COVID situation. And I don't know how many people have kind of made their way over to Greenwich Avenue and seen what's happening in terms of the outdoor dining. That I saw a lot of smiling, happy people this past weekend. And so if this is something that's in the budget that can help sort of think about how we move forward on this, I am supportive of that.
Leslie, did you have anything?
Yes, I did. What was the delay? You had the money as of last July. I'm just curious.
Well, Peter had one idea of how to deal with this, which was directly with a single source designer. And when Fred came into office, that wasn't how it played out. And so we ended up going out for an RFP. And so that designer that Peter originally started talking to he submitted a package, and we had 6 other packets submitted. So it's just how each one wanted to approach this. And so we are where we are today. And the decision was made by Fred and Ben to go out on an RFP to obtain the services that we needed.
So do I have a motion to,
So let me speak to that just for 1 second. I mean, I'm not going to support this item. If the BET reaches a conclusion that there's no capability of the town under this COVID onslaught to be able to deal with this as a capital item and has cut it, I don't want to spend $50,000 to do design work on something at the moment at which the item is a future item, which the BET has a will to support. I would gladly have spent this money for that. But given the fact that the conclusion was made that we can't do this capital project, let's look at it some other year, I'm not going to support the carry forward of this design money.
well, the money is, as I understand, that's to pay for what is already out in the marketplace, Jeff. And again, it's going to take them a while to get through this phase, and it won't be long before we have more budget meetings to consider the next steps. Quite frankly, I think having the understanding of some potential here, I think makes sense for the town. And, Greenwich is opening up again. And I think, we've all been concerned about our waterfront and how it's used for a long time. This is a first step in that movement. Whether it's delayed by another 3 or 6 months, I think is inconsequential. I think that beginning to put together the base is very appropriate.
Well, I'm just trying to respect the will of the majority that the town is overwhelmed and can't do these capital projects. So I'm not going to support design money on something on which the town is overwhelmed and can't do the project.
So, okay, so do we have a motion, Deborah?
Sure, I'll make a motion to support this capital carry forward.
And do we have a second? I'll second that motion. I'm sorry, Leslie, did you second it?
I'll second to put it on the table.
Okay, so Deborah and Leslie. And I mean, I think it's important to, in terms of trying to bring back our town, to begin to move these projects, at least the very first step, which was contemplated 2 years ago, to bring it forward. So I'm going to support this. So may I take a vote? Deborah?
Yes.
I vote yes. Leslie?
No.
Jeff?
No.
Okay. Okay, at this point in time, that motion fails. The next one, Joe, is continue enforce the repair to the Greenwich Point Causeway, $850,000.
So, yes. So when last we met at the budget meeting a year ago, when we talked about this was quite an expensive project. I mean, we were talking about $4.1 million to replace that whole causeway. So what we did was we asked for this $850,000 to kind of pare it down, and to get it to something that's much more manageable for not only for the town to execute, but also to make the improvements that we need to make, and to try to come in at a more reasonable price. Now we have some money that has been carried over that we've been using, and this additional $800,000 would give us the ability. $850,000 would give us the ability to complete the projects. Now our goal is to start the project in October or November of 2020. We've enlisted, and with some great help, the DPW engineering has now come on board with us to help us manage this project. I mean, obviously, there's two components to this project. There's the water side part of it where the seawalls come into play, and there's the road section and railing section where Parks and Recreation has very limited experience with. So through Jim Michaels, we've now been working with one of the engineers at DPW to advise us on the road section and the railing section. We've had meetings all the way up until the beginning, until February, when things kind of fell apart here and we were out of town hall for a while. And now, our goal is to get this back up and running so we can start the project sometime in October or November 2020. There's some things that have to be done here. The road surface has to be reconditioned. The railing should go in on the Eagle Pond side of the roadway. There's a significant amount of tidal erosion that goes through there based on the flow between Long Island Sound and the pond. My concern is that if we don't do some of these important things, that we will jeopardize the road itself in future years coming. So we need to do this now. The whole bigger issue of the sea level rising and such is going to be a bigger townwide issue. I know that the Conservation Commission, Pat Sesko and her committee have been dealing with that, but we're talking about some things that will keep the integrity of the road in place so that, barring some major storm that is unforeseen and unpredictable, we'll be able to have access to the backside of Greenwich Point on a routine basis. So the money is needed. It all comes as part of the package. We've gotten it to just barely over $2 million to do all the work that we need to do an upgrade of that road surface, the railing, all the flood zone issues on the pond side, and we should be able to complete that. Start to complete this over the course of next winter. It may be a 2-winter project, depending on how it all kind of lays out, because we will have to, depending on how we schedule it or how the project engineering lays out, what happens is that we may have to isolate the whole back end of Greenwich Point for a period of time. Nobody really seems to want that because it creates no access from the Clambake area parking lot all the way to the back of the Greenwich Point by vehicle, by car. And I think walking would be fine, biking, jogging, those types of things. But all vehicle access will have to be restricted for roughly 3 months or so, 3.5 months. The way I'm looking at the schedule. So depending on how we break it out, we're going to take care of some of the important things first. And we right now I've just seen this past week a detail on the installation of that outward bound railing along the causeway there from the 2 pillars of the Holly Grove area roughly to the boatyard, which seems to be a big want by everybody as a result of some of the litigation we've had at other locations. So I think we've accomplished the detail on how to deal with the railing.
So Jeff has a question.
Yes.
So a couple of things, Joe, if I can. Your written presentation said that the project has become a little more complex. You're not an engineer, but they said you're comfortable. Could you give us a sense of what you mean when you say it's become more complex?
Well, believe it or not, the road surface is relatively easy to deal with. Even some of the seawall issues are relatively easy. The one challenge that we just had was how do we put a guardrail in there that's meaningful, in the sense that I can put up any kind of rail, but does it have any retention for a vehicle? You know, and since the road surface is about 12 inches higher than the seawall, it created some real challenges of how to anchor those posts into that seawall in order to get some kind of, you're supposed to drive at 15 miles an hour or less. We know that sometimes that happens, sometimes it doesn't, but just the weight of a vehicle and, you know, so we wanted to put something in there that's going to be meaningful because the purpose of the rail is to keep somebody from driving over the edge. And so the anchoring system for that railing became a little bit challenging. And how do you get it in there? Do you dig it in? Do you cement it in? Do you hammer it into the rock? I mean, there's a bunch of ways that we looked at. And I think that with the help of engineering, we came up with a detail that talks about, you know, some digging, some tapping it in, and then concreting it in. So it has some retainage factor on when vehicles are driving on the road so that they won't, you know, hopefully under a certain speed, they won't be able to drive off the road.
Joe, a follow-up question if I can. So I think I heard you make reference in your presentation a little bit earlier about a $2 million figure. You may not actually know good numbers maybe until some of this money is spent, but was I understanding correctly that you're expecting this project in the overall to be about $2 million and take approximately 2 off seasons to complete? Is that what I heard you say?
I mean, we have an open appropriation of $1.3 million and plus the 800,000. So our goal is to make it, you know, get it in there. We feel comfortable that we can, with some of the reduced scope of that grander project, that we can do this. I don't have any numbers. We didn't bid this out yet, but our goal is to try to keep it within that dollar allowance. Yes.
Of the $1.5 million plus the 850,000.
Yeah,
so it'd be 2 million and a little, actually. Then
yeah,
you think.
That's correct. Yes.
All right. And am I right that pretty much all of this would be bonded? In fact,
I can't tell.
Sorry,
Yeah.
Roland. It catch you in a moment. Your back was turned. I thought I'd ask you a question as soon as you turned around.
It is a bonded project.
Yep.
So the cost of that would be borne by the town over a 7-year bonding process.
Yes.
Okay. All right. Thank you. I going against the flow of the previous item, just because I worried for a long time about the safety of this causeway as it goes across. Despite what was done at the end of April by the BET, I would support the carry forward of this item.
So are you making a motion, Jeff?
I think Leslie might have had some questions. Others might have questions.
Leslie, do you have questions?
I didn't have questions. I wanted to move this along. I think we need to continue our maintenance projects. So I'll make a motion to approve the continuation of force for this project.
So
I'll
Leslie made the motion and Jeff
I'll
seconding
second.
it then?
Yep, I'll say.
And so those in favor, Deborah, do you have anything?
I'm in favor.
Okay, so is that a, that's, and I will vote in favor also. So that's a 4-0-0 in favor of capital carry forward. Okay, so the next one, Joe, is again, continue in force for the Greenwich Harbor dredging for $2 million.
I really can't tell you any more than that. This $2 million back when, 2019, when the money was placed in Parks and Recreation's budget, is in a special account. It's in an F account, which still is under 834, but this is for the dredge project at Greenwich Harbor. And this was the town's commitment to that dredge project. The last meeting that I attended, which was more of an in-house meeting to bring Fred up to speed, was in January with Fred Camillo, myself, Mike Van Oss, and Frank Mazda were all at the table discussing this project of, to see if it is in the queue. The money will be coming from the state of Connecticut to execute the project, and the engineering and services and testing and project oversight will be coming from the Army Corps of Engineers. All I know about this, and I don't have any more information, is that this is the town's commitment to say that we would partner with the state and with the feds on getting this harbor dredged. There hasn't been any additional conversation since maybe the end of January, mid to end of January.
So do we have any questions on this, or are we ready to move this one forward? Jeff?
I'm sorry to be constant of the person asking the questions. So, Joe, if this were to lapse, does that cause the position in the queue that we have for the dredging to evaporate, and then we might have troubles getting the state back again with their undertakings?
Jeff, I can't honestly answer that question because the state was very aware when we appropriated this $2 million that the town was in and was going to be that partner. I have no idea. I haven't been monitoring this. This is a harbor management issue that what that would create if the money were just to be lapsed, whether they would take it off the table and say, well, we'll move somewhere else, or I don't know. I can't honestly answer your question.
The second question is, was there an issue on this item as far as there being a place for the repository of the effluent which is dredged? Was there a problem, and if so, has that been resolved at this point?
There was a discussion because some of this material is more contaminated than other materials that are in the harbor, and the big problem that needs to be solved here is that would be solved by the Army Corps of Engineers and their participation, is because they are required to deal with the engineering, the design of the project, dealing with the sediment analysis of the project, the sedimentation, and where that would get placed. Generally, the Army Corps of Engineers, because this is a federal project, would have some much greater leverage than a local community to get things placed. At our January meeting, Jeff, the only thing I can tell you is that that was not a topic of conversation about a delay because of the sediment material. It was more about where's the money at the state level. What agency of the state will be providing the balance of the money to do the project?
Okay, last question, I promise. It's a Roland again. I assume that the expenditure of these funds would also be bonded. Yes, Roland?
Yes.
So it also would be paid off theoretically by our usual habits over 7 years.
Yes.
Thank you. I will support this item.
Okay, so are you making a motion, Jeff?
Sure, I'll make the motion to carry this forward. Mhm.
And do I have a second?
I'll second.
Go ahead, Leslie's fine.
And those in favor?
Aye.
And I also voting in favor, so that's a 4-0-0 vote. Okay, Joe, I think we move on to the next one, which is PR 6, to continue to enforce seawall repairs.
Yeah,
wanna-
this would have gotten done if we didn't have break in workflow. I mean, as far as our intentions is this is a small amount we kind of put in every year to do little sections of seawall that just to maintain and improve some of the locations. Obviously, we got a little off track here, being out of town hall for a couple of months, and our contractors working at a different pace. So our intent is to roll this over and get it back up in the queue as quickly as we can. Some of this work can be done easily in the summertime. So, there's nothing more or less than that. It's just that it was just an timing project because of the break in the lapse in the workflow at town hall.
Okay. This is maintenance, isn't it?
We probably have thousands of feet of seawall, and it is just maintaining what we have, and it's something that we need to do. Yeah.
So do we have a motion to carry this forward?
I'll move that.
I'll second.
And Deborah seconded it?
Yes.
Those in favor?
Aye.
Aye.
And I'm an aye also, so the vote on this is 4-0-0.
Okay, thank you.
Thank
Thank
you.
you.
very much.
Oh, thanks,
All
Tom.
right.
Thanks.
Talk soon. Thank you.
Thank you, Joe. Thank you,
Bye.
Tom. So Roland, I've got a question for you. You have had us add the Board of Education on there, but I haven't seen them on our list of people attending. Are
I
they
spoke
still
to-
ask?
I spoke to
asking for
Sean
this,
this
Roland?
morning, and
I'm sorry?
I spoke to Sean this morning, and they're going to withdraw it at this time, and it will be resubmitted when they come in to the transfer meeting.
Okay. Okay, so it's withdrawn. Thank you very much. So Roland, I guess you're on deck to tell us about economic conditions and to update us in terms of, what's happened through the end of May in terms of where we are year to date and as we head into fiscal year end.
If you look at the expenditures, as of the end of May, we are $400,000 below last year's spending. So the COVID-19 issues have really ratcheted back on the spending everywhere. And,
Do we think that all the expenditures are there, Roland, for the
there may be
COVID? And
there may be some lags, but like I said, we're behind last year's spending, and as a percent of budget, we are even less than we were a year ago.
so do we have any questions from anyone on this list?
I just want
Is
to
it-
make I do.
Speak for yourself. Leslie?
I just, so as we think about the spending, I think the related question is what's happening on revenues. And I think, Roland, you had some information about revenues as well.
On the big,
Roland, I think when it was, nothing was submitted on revenue is just because our meeting is so early in the month. But Roland, can you update us?
well, we're still lagging behind on some of the postings with town clerk and building permits.
Okay, so
So-
I think Pete has a.
So just let me, I want to just, before we leave Roland. So Roland, when that information comes in to you, can you just please update what you normally would give us last month?
I think Pete had some further information. If Pete has the information, I'd like to hear it.
Okay, Pete?
You were gonna ask Roland to do something first?
Well, I was just going to ask Roland, once he has the information for that, the page he gives us on revenues every year, if he could just update that sheet, every month and send it to us. That's all I was going to ask.
I can give you a general overview.
Okay,
Please.
great.
Without drilling down too deeply. And I'll combine it with Jeff Raymer's email this morning. So I'll start with all revenues. As of today, I ran the report. Out of the $428.8 million revenue budget, we've collected 99.8%. That's 1,019,000 is not collected. However, we've got about $4 million of revenues that have not been posted, which would bring us up to about a $3 million surplus. And some of the revenues that have not been posted are, one is $803,000 sped money we received about a month ago. We're waiting on the Board of Ed. We've got up to $1.2 million in LoCIP that hasn't been received. It's 3 years behind. We still have cancellations of encumbrances, and we still have the final revenue transfer from Nathaniel Witherall. So at a minimum, we're going to be at least $3 million surplus on the revenue side. Now, if you'll let me continue, I'll address some of Jeff's questions in his email. And the first one had to do with tax collections. As of today, we have a surplus in the tax collections of $1,123,000. So we've collected slightly over 100%. However, you've got to take into account Howard Richmond's program. His tax collection program from last year, 18-19, there was a substantial spillover into July, August, and September. So that bolstered the collections, and we have a nice surplus in the tax collections, which I'm going to attribute a lot of it to Howard Richmond's collection program. The COVID, the executive order for the governor is not going to kick in until after July 1st. And because we're so late in the year, there's no impact from the COVID-19 experiences. Interest income. We've on a budget of $1,750,000. We've got a surplus of $1,080,000. However, the bulk of that was collected up front through the first 9 months, and we all know that the interest rates have dropped down sharply. Let me see. Bear with me. I'm looking at Jeff's email. The conveyance tax and building permits. On the conveyance tax through today, we've collected 81.9%. So some of the good news that I'm giving you, here's where we're short 905,000. June is notoriously a good month. So there's going to be a shortage of at least about $500,000 there in the building permits. I'm sorry, the town clerk on the conveyance tax. On the building permits, we are bear with me. It's
We're not going anywhere, Pete.
yeah, but I want to get done before Deborah's
Oh, okay, you're right. Sorry.
Kicks in. Building permits, I'm sorry. We've collected 84.8%. On 4.5 million, we've collected 3.8. So we're going to come close to, we're going to be $200,000 or $300,000 short on the building permits.
I'm sorry, could you just give us what did you say was 84%?
84.8% collected.
Yeah. We, on 4.5, we haven't collected 684. Now, take into account, and this is to Roland's comment earlier, and I'm not done with all of them. There is a lag here. Not everything is posted. So in some cases, we're months behind on the smaller ones, and some were on a weeks behind. Interest income, state and federal grants. I told you that we've got 3 years of LoCIP coming in, 1.2. We've got the bridge money that we collected. I think it was about 900,000. Baileywick Bridge, 994,000, and Riversville Road Bridge. So we've collected about $1,130,000 that was unbudgeted. Let me see. Another piece was beach cards.
No, stay with the state, the state reimbursements, grants, et cetera, for all the money all upcoming from the state or federal government, whether it be aid or grants. Where are we on that as far as the annual budget? I know we budgeted a very low amount. I think it was 600 some odd thousand, but where are we on what we received all up from the state and federal government?
Well, I've mentioned almost all of them, but I'll repeat it. Okay, in the case of the Board of Education, we've got 803,000 SPED money from the state that's not granted.
Right.
Not budgeted. We got $294,000 from ECS. Okay, so right there, you're $1,000,001. I'm going to go back to the bridges. Again, you've got 994 and 139,000 on the bridges that wasn't budgeted.
So that's $1 million.
Yeah, okay. The LoCIP is we didn't budget any this year. We're 3 years behind. We haven't gotten 2018, 2019, and 2020. I've been assured that we're going to get it this year. That's 1.2 million.
It's 4.2?
1.2.
So assured you for this year, you mean in fiscal year 20? Or this calendar year, or what are they saying to you?
This is right now, this year. This is all this year.
Fiscal year.
Yeah.
Okay.
For example, in the case of the LoCIP, that's 3 years. Next year, you're only gonna, and we haven't budgeted, it's only gonna be about 330,000. There's a sharp drop off. So that's all of the state aid that we've gotten this year that's been unbudgeted. I didn't do the math. What was it, about 5 million or 4 million?
Yeah.
3.5.
Okay. And again, beach cards. And this is Jeff Raymer's email. We budgeted
Me.
What?
Blaming me.
Well, no, these, a
No,
million
no, I
five for beach guards.
Yeah.
I wish I had butt in and asked Joe when I had him before.
Yeah.
We've collected 382,000 on $1,075,000, and we're under budget 692. We've got 3 weeks left, but when I last spoke with Joe Siciliano in the building here about 2 weeks ago, they're way behind in processing. So we don't know the shortfall in beach cards to date. So that might be a misleading number, Jeff.
So I asked Joe if he'd have somebody answer that question. It's a question I asked him about a week ago. And Tom Greco kindly sent me an email, maybe I could share it with others, in which they too said that they're well behind in the processing, but from what they've already processed 49% at this point of sales compared to what was budgeted. Now, whether or not that'll finish up at being 100% or not, I don't know the answer to that. But they've already processed for 49% of the dollar amount budgeted. There was a difference between the dollar amount and the number of beach cards. That's funny, there's quite a bit of variance there. He gave me both figures, but the 49% was dollars collected compared to budgeted.
Right, that is the problem. The problem with that answer is that I'm looking at what's posted today.
Yeah.
We've got 35.6% posted.
Okay, I can't explain the difference.
Yeah, that's the Roland's previous point. We're getting money in, and we've for sometimes months, sometimes weeks, but there's a huge difference. The money goes into the bank, but it's not getting into the Munis system because a lot of people are working remotely. So that's a perfect example. I'm glad you brought that up. They've got 49% collections a week or two ago, and we've got in Munis 35.6%.
So if Tom has got a new car, we ought to worry about it. Is that it?
They're doing a great job over there.
Yeah, no, I'm just.
So that's where we are overall. And there's a lot of revenues in the land use area, in the parks and recreation, the smaller programs, where we've got we've got shortfalls all over the place. So that's why the revenues aren't going to be any higher, but they're all small shortfalls. So I'll
But
open
all
up
these
any questions.
comments lead us to say, I know that Pete, you've been really conservative to say that fund balance is going to be flat at the end of this year. But these unbudgeted state revenues, the fact that we're 400,000 below last year's spending, that doesn't even account for the increase in the current, it's not versus budget, it's versus last year's run rate. We're going to be increasing fund balance by the end of this year. So whether that's a couple of million, maybe a little bit more than that, maybe a little less than that, we certainly, the experiences that we've had with COVID for the past 3 months, not hurting the town's current financial picture.
Yeah, I would agree with that.
May I, on that, may I say something? So I think where we're going is we think the fund balance at the end of the year is going to be what, roughly 68, 69 million, including capital non-recurring and the risk fund. Is that right?
A little too much.
You're adding all three?
Yeah.
If we broke even on the general fund, that's 63. The capital non-recurring is about 10 million. That puts you at 73, and we're at a 1.6 with the risk fund. So somewhere around 74 million. The risk fund, you're not going to have any settlements in the next 3 weeks. The capital non-recurring, you're not going to draw down in the next 3 weeks. The biggest question mark that I have is, to Leslie's Moriarty's point, if we exceed the $12 million give back on the expenditure side, yes, we will have a $1 or $2 million surplus instead of break even. So,
but we are using right now, the budget as presented is using up $19 million of that fund balance, right? It's so. I mean, I just want to
no. That's there's two different. You have to, for the current operations, you have to use the current use of fund balance. It's like 12 million. It's, I mean, 15 million. You gotta
Right, plus, plus
the
there's the
current
4
year.
million we're using for the
Yeah.
Witherall.
For the BET policy, when you take the unassigned and the assigned on the gap basis, you're reaching forward. And I
Mhm.
know it's very confusing. They're distinct here. When you do operating results, you've got to use the current year's use of fund balance. But when you use the BET policy, you've got to grab the 19.1 million. And what that does is strips down the unassigned and the assigned.
Yeah,
It's
I guess that's where I was going. I mean, just getting through it, we are using, whether you look at what point in time, we're using up $19.1 million in our general fund balance between what right now, what we're using also in addition to the Witherall.
Yeah.
Okay.
Yes.
But to put that number into context, we typically have used 12.8 million of that, which gets returned at the end of the fiscal year to close a budget gap. So that $19 million is not intended to be a 100% outflow of funds.
And I agree that typically it's roughly around $12 million, but we're incrementally using right now as presented another 7 million. And when I think of the fund balance, I think about it in terms of how much cash can we really use. We can't use the capital non-recurring, right? Because that's set aside for something. We can't use the money in the risk fund. Again, that's set aside. So at the end of the day, based on the numbers I'm looking at, I think after you take that 19 million out, there's roughly $38 million, which on our budget is 8.5%, so I just think when we think about the fund balance, I think it should be what is the available cash. And I think it's not as high when you consider what you can actually spend, because you cannot spend capital non-recurring and you cannot spend the risk fund.
And I would make 2 points to that. Number one is we do have the option of using some of that capital non-recurring to offset cash projects. We talked about it at the budget committee in the quick response and the changes made on April 27th. We didn't address that opportunity, but we can use some of that $10 million, which I think Pete has said in the past is certainly at a sufficiently high level that could be reduced somewhat. And secondly, we based the decision of the budget on assuming that our fund balance was going to be flat to the end at the end of the year. And we just heard from the controller that he's expecting fund balance probably will be higher, whether that's 2 million higher, 3 million higher, don't know the exact number, but certainly that is a change from when the budget was approved by the BET.
Right, and also we do have this tax deferral, right? So we're also contemplating that on the other side of what you're saying. But anyway, I just wanted to make sure I was thinking about those numbers the right way. So thank you, Pete. Sorry, we can move on.
The tax deferral really just is the interest value, the investment value of the $200 million that we would have collected over 3 months. I mean, it's probably a number in the order of $350,000. It's not millions.
It's still a use of cash.
Really
And the
a practical
other,
question
it's-
of whether or not we have the cash flow to cover our needs, which our controller has been saying to us, we have the cash flow.
So Leslie Tarkington, I don't know if you can see, but Mike Mason has his hand up. I'm not sure if you're willing to.
It's not showing up on my thing.
Well, just give him a chance to speak anyway.
Yeah, it's
See-
showing
Oh,
up
no,
on
no,
mine.
okay,
I don't know.
so Mike, yes, please speak, Mike.
So in a world where we like to see people confused about numbers, Peter Minarski, can we please get something that is consistent on fund balance? We need a June 30th fund balance number. We need a July 1 fund balance. Then we need to carve out, which is specific, what monies are coming in extra from return to close out of fiscal year. As you know, when you close out capital projects, such as the 50,000, there's a resolution that money goes into capital, not very specific for capital. So we know we have to earmark that as separate. Okay, we need to have this. This is what's causing the confusion. How many district meetings did we go to? How many committee meetings where we hear about, all this rainy day fund, which doesn't exist? We need a consistent number. We're finishing the year. We anticipate finishing the year at, call it 64. I do think it's going to go up a hair with some of the unspent money, by the way. I think I agree with Leslie Moriarty's point there. Although until you get 60 days past the end of the year, by our policy, you can't count on that money because that's the allotment we have for our accounting policies for closing out the fiscal year. July 1, we go from 64, forget what we think, we're going to use X amount of the 64 with the same amount earmarked for capital. We need to have a consistent set of numbers. And then there's budgetary and there's all this. As far as the tax deferment, so we're all clear, in September is our date where we will decide on a TAN, tax anticipation note, if we decide we want to get the preparation going for that. That's where I think the budget committee left me, and I have that as a placeholder for that conversation. So yes, there could be a cost of tax deferment. No, I know it sounds like we're in good fiscal shape to get through that, but that was part of that plan. So we need to have consistent notes. I believe that July 1, we're probably expecting a unrestricted fund balance of about 58, and then we're going to see when the year closes out, that may roll up 59 or 60. That's how we should be presenting it, because everything else is just, I've heard 100 different variations of what balance is and how we have it. Thank you.
I can't see any other hands up. Deborah, did you have your hand up? Are you?
No, I just was, I'm good. I'm good. I think this is I think Mike's point's a good one. It'd be helpful to have that for, I guess, Monday night.
Right. And also, as I said, I'd like Roland at least to put the other numbers he normally would into a report and send that around to all of us too. That would be helpful. I like to see numbers in writing. I'm a little bit nervous about, still promises coming in on LoCIP when we haven't seen anything in 3 years or whatever. So, again, that's my preference too. I think, Pete, you also had an additional page that you sent to us in terms of what was happening right now in terms of COVID and potential reimbursements to the town from the state for the numbers that we're tracking. Do you want to just give us a minute on that, please?
Well, real simply, that's what the State of Connecticut Office of Policy and Management under the Coronavirus Relief Fund asked everybody to submit their projected expenses and revenue losses, but the expenses through June 30th, the $1,018,000, going back to Larry Simon's comments, 794,000 of that is Nathaniel Witherall's. And then there's two small pieces where the health department's already been reimbursed about 17,000, I think, for one piece. But that is, I'm going to apply for it tomorrow, the $1,018,000 minus the small pieces from the health department. And if you looked at the document at the top, there's a little line called revenue loss. I don't know what that means as far as reimbursement, but we calculated, one of the examples was the beach cards. If we were doubled that number that I gave you before, we'd be short a couple $100,000. And then there's a whole bunch of programs where we had to refund money. So there's a revenue line in there for $1 million. That would be found money if we got that. And I don't know when that money's coming in, if it's coming before June 30th or after June 30th, because the source is the federal government. So, and then right above that, there's a little piece where the use of money for $175,000, we're going to get reimbursed, allegedly, they asked us to put it in there, for the loss of interest income by deferring the taxes that were supposed to be collected by July 1st with a grace day into August. They're moving it from July 1st to October 1st. And we put in a 1% number, not even knowing what the interest rates are going to be in August and September. So that's what that document is.
Thank you, Pete. Thank you for staying on top of this. And I guess our departments need to continue accounting for their additional expenses. So appreciate that. We ready to move on to approval of the minutes? Should we start with the May Budget Committee meeting minutes. Do I have a motion to approve?
Leslie, how do you feel about just approving the 9 sets of minutes in one motion?
Well, I thought I would just separate out the regular meeting first, Leslie. So if we could get a motion on the May 14th meeting, that would be helpful.
A motion to approve the May 14th minute.
I'll second.
Seconded.
Okay.
And
Deborah.
I'm sorry, who seconded it?
It
Deborah.
doesn't matter.
Deborah.
Okay, so moved by Leslie, seconded by Deborah. Those in favor?
Aye.
Aye.
Aye. Leslie, aye. And I'm an aye too, so that's 4-0. So,
So I would
Deborah-
actually like, yeah, so I'd like to make a motion. I would like to approve the days 1 through 4 and just postpone 5 through 8 to the next meeting, just because I ran out of time this past week in terms of getting through all of those and would appreciate the extra time. So if we could just approve 1 through 4 today,
Okay.
I'm willing to move that forward. I
Okay,
didn't
so
get a chance to look at, I didn't get a chance to look at everybody's response back. So I'd like to just have that time to do that.
okay, great. Is there a second to that?
Seconded.
Thank you,
Okay,
Jeff.
so that's second by Jeff. Those in favor?
Aye.
Aye.
Okay, so that's 4-0-0 for that meetings number 1, 2, 3, and 4. Great.
Okay, so I guess we'll get started now. Good afternoon, everybody, and welcome to the May 28th Board of Selectmen meeting.
Time has been moved back from 5 o'clock to 10 o'clock in the morning to comply with the town hall working hours. So with that, do I hear a motion to adjourn?
It, so
Sure.
moved.
Okay, moved by Jeff, seconded by Deborah. All those in favor?
Aye.
Aye.
Enjoy
And
the
it
day.
is 12:59.
Wow, Leslie, you did it. Congratulations.
Great. Thank you all.
Thank you. Bye-bye.